Did you know that over 50% of people over 50 report having an active and healthy sex life? And that's just the beginning. Today, we're going to discuss 5 surprising facts about sexual health that will change the way you view intimacy. This video will demystify taboos and bring scientific data that can improve your quality of life. Before we begin, remember to subscribe to the channel, like this video, and turn on notifications so you don't miss valuable tips like these. And of course, if you want to support our content, consider becoming a subscriber member of our community. 1. The impact of physical health on sex life. A healthy sex life begins with a healthy body. This phrase is more than a cliche. It is backed by scientific studies and the practical experience of many men and women. Sexual function is closely linked to the overall health of the body, and one of the most important factors in maintaining that health is regular physical exercise. Research shows that engaging in physical activities, especially aerobic exercises such as walking, running, swimming, and cycling, has a direct impact on blood circulation. For both men and women, good circulation is essential for sexual performance, as it facilitates blood flow to the genital organs, which is necessary for both erection and vaginal lubrication. Additionally, physical exercise improves muscle tone, increases stamina, and reduces stress, factors that all contribute to a more satisfying intimate life. A study published in the Journal of Sexual Medicine highlighted that men who engage in aerobic exercise regularly are less likely to develop erectile dysfunction. This occurs because exercise helps improve cardiovascular health, a key factor for erectile function. The same applies to women. Improved circulation helps increase sexual arousal and response to stimulation. Besides exercise, nutrition plays a crucial role in sexual health. A diet rich in fruits, vegetables, whole grains, and healthy fats, such as those found in olive oil and avocados, can enhance sexual function. On the other hand, a diet high in saturated fats, refined sugars, and processed foods can lead to health issues like obesity, diabetes, and heart disease, which are directly linked to decreased sexual desire and performance difficulties. Cholesterol and blood pressure control. Cholesterol control is also essential. Excess cholesterol in the blood can lead to blocked arteries, including those supplying blood to the genital organs. This can impair the ability to achieve and maintain an erection in men and reduce pleasure sensation in women. Maintaining balanced cholesterol levels, whether through diet or medications prescribed by a doctor, can improve sexual health. Another crucial point is blood pressure. Hypertension can damage blood vessels, reducing blood flow to various parts of the body, including the sexual organs. This can result in erectile dysfunction in men and reduced arousal in women. One study revealed that hypertensive men are up to 70% more likely to suffer from erectile dysfunction. Avoiding excessive alcohol consumption is another important factor. While a glass of wine may relax and enhance mood, excessive alcohol consumption has the opposite effect. Large amounts of alcohol depress the central nervous system, which can reduce libido and impair sexual response. Additionally, chronic alcohol use can lead to erectile dysfunction in men and reduced sensitivity in women. Practical example. John, 65, is a clear example of how small lifestyle changes can transform sexual life. After a medical consultation, he decided to include 30-minute daily walks in his routine and started eating more vegetables, whole grains, and healthy fats. Just a few weeks later, John noticed a significant improvement not only in his energy and mood, but also in his sexual desire. By continuing these habits, he realized that his intimacy with his partner became more frequent and enjoyable. This example reinforces that improving sexual life does not require drastic changes, but rather gradual adjustments to lifestyle. According to the American Heart Association, people who engage in regular physical activity have a 30% lower chance of developing sexual dysfunction. This is because regular exercise helps maintain a healthy body weight, reduces bad cholesterol levels, and improves circulation, all fundamental factors for sexual health. And when it comes to age, these healthy habits become even more important, as metabolism slows down and the body requires more care. 2. The importance of communication in relationships. Communication is the central pillar of any relationship, especially when it comes to intimacy and sexual life. Many challenges couples face in bed do not stem from physical problems, but rather from a lack of communication. The difficulty of openly discussing desires, expectations, and frustrations creates emotional barriers that ultimately harm intimate connection. Many couples avoid openly discussing their preferences and what brings them satisfaction or discomfort during intimate moments. This can occur out of fear of offending their partner, personal insecurity, or simply not knowing how to initiate such conversations. However, leaving these topics unaddressed only increases the chances of misunderstandings, dissatisfaction, and frustration. Talking about what pleases or displeases is crucial to ensure that both partners are in sync. When these dialogues happen regularly and openly, a trusting environment is created where both partners' needs are heard and respected. This doesn't mean everything will change immediately, but rather that the relationship evolves based on mutual understanding, making intimate moments more pleasurable and satisfying for both. Beyond immediate preferences, it is essential to discuss long-term expectations. A couple's sexual life changes over the years, whether due to age, body changes, or emotional challenges. What was desired at one point may no longer be a priority in the future. Therefore, it is important to constantly adjust expectations. Just as we adjust our daily routines, we also need to adjust our expectations regarding intimacy. This can include the frequency with which the couple wants to engage, the experiences they wish to explore, or even the physical and emotional limitations that arise over time. When a couple openly discusses these expectations, they create a space of honesty where both can express their needs without fear of judgment. This helps avoid resentment and frustration, and more importantly, strengthens the emotional bond, which is the foundation of a healthy and lasting sexual relationship. A key part of communication is knowing how to listen. Often, the anxiety of discussing certain topics can lead one partner to speak more and listen less. Practicing active listening, where one gives full attention to the other's words and feelings, is fundamental. When a partner feels heard and validated, they feel more confident to share more openly. Respecting each other's needs and boundaries is also crucial. Not always will both partners' desires align perfectly, and that's okay. The important thing is to find a balance where both feel comfortable and satisfied. Sometimes this may mean compromising or adjusting expectations, but the point is that these conversations help the couple understand each other and grow together. If you find it hard to initiate this conversation, try starting with something light, like asking your partner what they enjoy most during intimate moments. This is a gentle way to open the dialogue, and by showing interest in the other's pleasure, the conversation will flow more naturally and be less intimidating. Another approach is to use a movie, book, or even an article as a starting point. You might say something like, "I read an interesting article about couples who openly discuss their sexual lives. What do you think about that?" These small approaches make a difference because they create an atmosphere of curiosity and care rather than pressure. Studies show that couples who openly talk about their sexual life not only report greater satisfaction, but also demonstrate a deeper emotional connection. Intimacy goes beyond the physical. It's about feeling emotionally connected and valued. When a couple can openly discuss their desires and frustrations, they develop a sense of true partnership, where both work to meet each other's needs. On the other hand, lack of communication can lead to distance. Small discomforts and dissatisfactions that aren't discussed can accumulate over time, often leading to emotional and physical disconnection. What could be resolved with an honest conversation sometimes turns into a larger issue. Couples who invest in communication are directly investing in the longevity and quality of their sexual and relational lives. A study published in the Journal of Sex Research revealed that couples who regularly discuss their sexual lives are 42% more likely to report greater sexual satisfaction. This shows that constant dialogue about intimate life is not only a problem-solving tool, but also a pathway to mutual pleasure and happiness in the relationship. When both partners know what the other desires and needs, it is easier to create an intimate experience that is rewarding for both. 3. Sexuality in old age, demystifying taboos. One of the most persistent myths in society is that an individual's sex life comes to an end with aging. For many, this idea is not only incorrect, but also harmful. The truth is that sexuality continues to be a vital part of life for many men and women in their later years. With the right approach and the elimination of prejudices, intimacy can not only be maintained, but also explored in a deeper and more fulfilling way. Myths about sexuality in old age. The belief that sexual desire automatically decreases with age often stems from negative stereotypes about aging. These notions can lead to a lack of conversation about sexuality among older adults, resulting in a cycle of silence and shame. However, the reality is that sexuality in old age can be rich and satisfying, reflecting a diversity of experiences, desires, and needs. Benefits of sexuality in old age. An active sex life in older age is associated with various physical and emotional benefits. Intimacy not only strengthens bonds between partners, but also contributes to mental and emotional health. Studies show that sexual activity can increase feelings of well-being, reduce anxiety and depression, and even improve sleep quality. Additionally, regular sexual activity can help maintain cardiovascular function, which is crucial as we age. Emotional connection and intimacy. As people age, many report that their priorities shift. Instead of focusing solely on the physical act, there is an increasing emphasis on emotional connection and intimacy. This can be a time when couples discover new ways to connect and express their love, whether through affection, intimate conversations, or shared moments that strengthen their bond. Often, the absence of work pressure and daily obligations provides a space where couples can explore intimacy in a more meaningful and relaxed way. Practical example. Margareta, 70 years old, is an inspiring example of how intimacy can evolve in old age. After retiring, Margareta began to notice a deeper emotional connection with her partner. She reports that without the pressure of work and responsibilities, their intimacy became lighter and more satisfying. They began exploring new aspects of their relationship, such as sharing hobbies, traveling together, and even experimenting with new forms of intimacy. For Margaret, this new phase brought a rediscovery of the pleasure and connection that sexual life can offer. The importance of education and dialogue, demystifying the taboos surrounding sexuality in old age, is essential for older adults to fully enjoy their sex lives. This involves education, both for individuals and healthcare professionals. It is crucial that doctors and caregivers are prepared to openly discuss sexuality with their patients, addressing issues such as sexual dysfunction, menopause, andropause, and other changes that may occur with age. Moreover, promoting sexual education among older adults can help clarify misunderstandings and prejudices, empowering them to seek satisfaction and sexual pleasure. This may include conducting workshops, distributing informative materials, and creating safe spaces where older adults can discuss their concerns without fear of being judged. According to the Global Survey on Aging, about 53% of people over 60 still consider themselves sexually active. This statistic challenges the common view that sexual desire disappears with age and highlights the importance of more open dialogue about sexuality in old age. The reality is that many older adults still seek pleasure and connection, and it is essential to recognize and validate these experiences. It is also important to note that sexuality in old age is not a homogeneous experience. Each person has their own story, preferences, and needs. Some individuals may find pleasure in monogamous relationships, while others may explore new forms of love and connection. What matters is that sexuality is an authentic expression of who they are, free from restrictions imposed by social norms or prejudices. For mental health and its relation to intimacy. Mental health plays a crucial role in our sex lives, affecting not only sexual desire, but also the quality of intimacy we share with our partners. Often, the stigma associated with mental health issues prevents people from seeking help, but it is essential to recognize that taking care of mental health is just as important as taking care of physical health. The impact of mental health on sexuality, anxiety, stress, and depression can create significant barriers to intimacy. Anxiety, for example, can lead to excessive concerns about sexual performance, while stress can distract from intimate experiences, making them less enjoyable. Depression, on the other hand, can result in a decrease in sexual desire, leading to feelings of frustration and inadequacy. On the flip side, engaging in activities that promote mental well-being can have a positive effect on sexual life. Meditation, therapy, and other relaxation techniques can help reduce levels of stress and anxiety, allowing individuals to feel more emotionally connected with their partners. This emotional connection is fundamental for a healthy and satisfying sex life, as a good relationship is built on trust and open communication. Practical example: Joanna, 58 years old, is a great example of how mental health can impact intimacy. After experiencing intense stress at work, she noticed that her sex life was suffering. After discovering meditation and incorporating this practice into her routine, especially before bedtime, Joanna began to relax and de-stress. Over time, she noticed that her emotional connection with her partner improved significantly. This renewed connection not only revitalized her sexual desire, but also strengthened the bond they share. Research indicates that the level of sexual desire can increase by up to 60% in individuals who treat anxiety through cognitive behavioral therapy. This therapeutic approach helps individuals restructure negative thoughts and develop strategies to cope with anxiety, which in turn can improve the quality of their intimate life. The importance of seeking support. It is vital for individuals to recognize when they are facing mental health challenges and seek professional support. Talking to a therapist can provide valuable insights and help uncover issues that may be interfering with intimacy. Furthermore, discussing these challenges with a partner can create a safe and welcoming space to explore feelings and concerns. New discoveries about sexual dysfunction and its treatments. Sexual dysfunctions, such as erectile dysfunction and decreased libido, are more common than many people realize. They can affect men and women at different stages of life, and those affected often feel isolated and ashamed. However, it is essential to understand that these conditions are treatable, and that advancements in medicine have provided effective options to address these issues. Understanding sexual dysfunctions. Sexual dysfunctions can have various causes, ranging from psychological factors like stress and anxiety to physical issues like diabetes, hypertension, and hormonal imbalances. Identifying the underlying cause is crucial for determining the most effective treatment. Often, a combination of psychological therapy and medical treatment can provide the best results. Advancements in treatments. In recent years, medicine has made significant progress in treating sexual dysfunctions. Options range from hormone therapies to medications that help improve sexual function. For example, phosphodiesterase type 5 inhibitors, such as Viagra, have proven effective in treating erectile dysfunction by increasing blood flow to the genital area. Additionally, new treatments are continuously being developed and tested. For instance, shockwave therapy and the use of vacuum devices are emerging options that have shown promising results in clinical studies. These treatments can be especially helpful for those who do not respond well to oral medications. If you or someone you know is experiencing difficulties related to sexual dysfunction, it is crucial to consult a doctor before starting any treatment. Each case is unique, and a healthcare professional can help determine the best approach based on individual needs. It is estimated that 40% of men over the age of 40 experience some degree of erectile dysfunction, but up to 85% of cases can be successfully treated with the right interventions. This emphasizes the importance of seeking help and not allowing stigma or shame to prevent people from obtaining the necessary support. It is important that the conversation about sexual dysfunctions is demystified and normalized. Speaking openly about these topics can help reduce stigma and encourage more people to seek help. Encouraging communication between partners is also essential, as this can strengthen intimacy and understanding during vulnerable moments. These are just a few of the many aspects that involve sexual health. The most important thing to remember is that intimacy is a natural part of life and, with the proper care, can be enjoyed at any age. Don't let taboos or myths hinder your journey to a healthier and more satisfying sexual life. If you like these tips and want more content like this, don't forget to subscribe to the channel and activate the notification bell so you don't miss our upcoming posts. And share your opinions or questions in the comments. We love hearing from